Hello, my name is Nick Cunniffe and I'm a consultant neurologist based in Cambridge, specialising in multiple sclerosis. And today we're just going to talk a little bit about some of the examinations we do for people living with multiple sclerosis. So one of the key assessments is something called the EDSS, the Expanded Disability Status Scale, EDSS. Essentially, it's a neurological examination. It's where a neurologist or a specialist nurse will examine various different elements of the functioning of different groups of nerves, paying particular attention to those nerves that are most commonly affected in MS. So what we tend to do is we tend to pay focus on vision, and we tend to see how well the eyes are functioning at being able to read. We test the ability of the coordination of the eyes to move together and ask if people have double vision. We test sensory nerves, the ability test things like vibration, joint position sense, and pain. And we also then test the motor nerves to test if people have weakness, if they have stiffness, sometimes known as spasticity, and other elements of the motor system as well. We also like to examine people's speech and their swallow. And also, because it's commonly affected in MS, we ask questions about the bladder and the bowels as well, to see if continence has been affected. So what you might expect is a physical examination that lasts about 5 to 10 minutes, depending on what elements are performed by the clinician, followed by a series of questions about bladder and bowel function, and also ambulation. So what supports you might require for walking, if any, and also how far you can get. So one of the things that's really helpful before having a neurology appointment is just to think about how far you can walk, with breaks if you need, but how far can you walk and with what support might require, because we like to know if you can walk a mile or so, or if you're limited perhaps to a few hundred meters. It just helps us make that determination. But by and large, it's a quick test that we do all the time, and it's very similar to any old neurological examination. First, we're going to start by testing your vision. If you could, I'd like you to cover your left eye. And you've got your glasses on, so I assume those are for distance. So you can see, using this chart here, which is about 2 meters away, can you read out the bottom line that you can see in full?
Okay. V.
Perfect. Oh, the other eye?
SNHO.
Perfect. The next thing, if you cover one of your eyes, yeah, I'll copy you. Look straight at my nose. Okay. While you're looking straight ahead, I want to test your peripheral vision. So just let me know if you can see my finger moving. There and there.
Yeah.
Now cover the other eye. Looking straight at my nose. Yep. Look at my nose. Can you see that moving at the side? And there. Look at my finger. Head and I still going to look at your eye movements next. Okay. Do you see double vision at all? Do you see it now?
Yeah.
Okay. Look here. Just follow it with your eyes. And do you see double at all? And next, I'd like to have a look at the back of your eyes. So if you take your glasses off for me, I'm going to turn the light off. I'm going to look at the back of your eyes now. So if you look straight at the wall there, I'm going to put a hand on your shoulder. I'm going to have a look, come up quite close and have a look at the back of your eyes. Keep your vision fixed there. Okay. So just thinking about sensation next, can you feel on both sides, and does it feel different on either side? Now more different. Do facial movements next. So if you lift your eyebrows up for me, screw them up tight. Open your eyes. Can you smile for me? Perfect. Open your mouth. Keep your tongue out straight. And your speeches are normal. I've heard that already. And your swallowing's okay. No problems there. Put your arms out in front of you next. Turn your palms over. Close your eyes. Relax. Okay. Open your eyes. Relax your arms down. I'm just going to move your arms around. So let them go nice and floppy, like you're a rag doll. Nice and floppy. On this side. And again. The next, we're going to test the strength in your arms. Arms up to the side like this. Push up hard and really want you to resist me. Like a boxer now. You straighten your arm and push away against me. Now on this side. Now pull me. Pull me towards you. Good. Wrists out straight and strong. Keep your wrists out strong. Strong. Fingers out straight like this. Push hard. Hard. Now curl your fingers into mine. So kick your fist. That's it. Good. I'm really resistant. Then test your reflexes next. So a bit of light tapping just around the joints. Start on the left over here. Over here. Next. Next. With a finger, can you touch your nose? I'll touch my finger. Nose. My finger. On the other side with the right hand. Nose to finger. Nose to finger. Can you put that hand on the top of the palm on the other side? And you turn it over. I want you to alternate that again as fast as you can. On the other side. Perfect. Okay. Next, we'll do sensation. Start with a tuning fork. This is going to test your ability to feel vibration. So as a reference, it should feel. Put it on your forehead, maybe. You feel that tingle? Do the same thing in your hands, if that's okay. Can you feel that tingle there? You can feel that better tingling there. I can test your ability to what we call joint position sense next to see if you can tell me where the joint is pointing up or down. So close your eyes. Okay, so if I moved it up or down?
Up.
Now?
Down. Up.
On this side? Now?
Down.
And next we're going to use a little pin. It feels a bit sharp, doesn't break the skin. There, do you feel that's a bit sharp? Feel this is a bit dull on the other side? I'm going to do both sides and I want you to tell me if it feels different between your two sides. Maybe if you close your eyes now, am I using the sharp side or the dull side there?
Dull.
No?
Sharp.
No?
Sharp.
Okay, so I'm going to move on to your legs next. This is where it's helpful if you're having an EDSS done to you wearing loose-fitting clothing so we can have a good look at your legs. Start with this left leg, lift it up, and I want you to hold it up in the air. Okay, relax it down, this one, same thing again. Perfect. Let your legs go nice and relaxed. Floppy, floppy, flop. Nice and relaxed. This leg, nice and straight. Lift it up off the bed. Let's see how strong you are. So push up hard. This one, up. Nice and straight. Get the legs completely straight. That's it. Push up hard. Push me down with this leg. Come push me down with this leg. Bend this knee. Push me away. Now heel towards your bottom. And out straight. This one. Push me away. Heel towards the bottom. Leg up straight. Put your feet up towards you like this. As strong as you can. Push it hard. Push it hard. Push down. Push down. Reflexes next. So legs nice and relaxed. And here, you're light tapping on the joints. So just a bit of a tickle with this little bit of plastic here on the bottom of your foot there. And here, that heel onto that knee. Slide down your leg towards your ankle. And back up in the air onto the knee. Now, ideally, we do it go down to the ankle and up in the air like this and down the ankle. And do it a couple of times. Perfect. Now try on the other side so I can see you do it on both sides. Don't worry. Okay, and then going the other way. Down the leg. That's it. Perfect. Let's finish by doing sensation. Can you feel that tingle there? And there. That's up. That's down. Both those eyes. Is this up or down?
Up. Down. Up. Down.
Going back to this pin again, it feels a bit sharp, but doesn't break the skin. So eyes closed. Am I using the sharp side or the dull side?
Dull.
Now?
Sharp.
Now?
Dull.
Now? Is there a difference between the two sides?
Could be a little bit less.
A little bit less on the side. So I'm going to test your walking. So if you walk just towards the camera over there, normally, perfect, and turn around. Let's make it a bit hard now. I want you to walk heel to toe like you're on a tightrope. I've got you. And relax. Okay. Now put your feet shoulder width apart. Put your arms out in front of you. Okay, don't worry, I've got you. But can you close your eyes? Perfect. Relax. Okay. And you're finishing. You can put your arms down. Can you hop on one leg? Do 5 to 10 on one side. And then we'll try the other side. Perfect. Okay, great. And we're finished.
To think about before a neurological examination. Wear loose, comfortable clothing, especially around the legs. Think about how far you can walk, with or without breaks, and whether you need support. Note any changes in vision, sensation, strength or coordination. Reflect on bladder or bowel symptoms you've noticed recently. Bring any glasses or mobility aids you normally use.